reduce muscle mass and increase fat, even when we are working out regularly, or maybe you're gaining fat, especially around your belly. That's a classic sign of low testosterone. Belly fat also produces estrogen. If you've been feeling tired lately and struggling to build muscle, or just don't feel like it might not be getting older, it might be low testosterone. And here's the kicker: millions of men are walking around with symptoms and have no idea what's really going on inside in their bodies. So today we are uncovering the subtle, sneaky signs of low testosterone that you should never ignore. If you catch these early, you can take action and fix the root problem naturally. Stick around till the end because the last sign might shock you. It's something most guys brush off completely. So let's get started. Sign number one: low energy or constant fatigue. We are not talking about the kind of getting tired you feel after a long day of work. It is a deep, lingering exhaustion that just doesn't go away, no matter how much sleep you get. Low testosterone can make you feel like you're running on empty all the time. Your body needs testosterone to fuel energy production, and when levels drop, so does your stamina. So if you're hitting the snooze button more than usual, skipping workouts, or struggling through the day without any motivation, this may be your body's warning sign, and it may be waving a red flag. Sign number two: reduce muscle mass and increase fat. Have you noticed it's harder to gain muscle even when we are working out regularly, or maybe you're gaining fat, especially around your belly? That's a classic sign of low testosterone. The hormone plays a key role in protein synthesis and fat metabolism. When testosterone drops, your body stops building muscle efficiently and it becomes easier to store fat. And here's the dangerous part: the belly fat also produces estrogen, which can lower testosterone even more, and then it becomes a vicious cycle. But the good news is, once you identify the issue, you can reverse it with the right habits. Sign number three: mood swings, irritability, or depression. Let's talk mental health. Isn't just about physical strength. It also supports brain function, mood stability, and confidence. Low testosterone can lead to increased instability, mood swings, anxiety, and even depression. You might feel less motivated, less sharp, or just not like yourself. And here's the crazy part: many guys go on antidepressants or anxiety medications without ever checking their hormone levels. And in some cases, fixing testosterone can lift the mental fog and help you feel like your old self again. Sign number four: low sex drive and performance issues. This one's probably the most obvious, but it's also the most common and the most ignored. But if you have noticed a drop in your libido or performance issues in the bedroom, it will be telling you that testosterone levels are out of whack. Testosterone fuels sexual desire, function, and overall reproductive health. While occasional issues are normal, a consistent drop is a strong indicator something deeper is going on. There's no shame in acknowledging this. It's more common than you think, and the sooner you address it, the sooner you can get back to being confident and connected. And the sooner you address it. Sign number five: hair loss or thinning hair. Losing a few strands of hair is normal, but sudden noticeable hair loss, especially in places like the beard or body hair, can signal hormonal imbalance. Testosterone and its derivative, DHT or dihydrotestosterone, play a major role in hair health. While some men are genetically predisposed to hair loss, a sharp decline can be your body telling you something is off internally. Sign number six: decreased bone density and joint pain. Testosterone is essential for strong bones. Without it, bone density can drop, leading to joint pain, stiffness, or even higher risk of fracture as you age. You may not feel this one until it's too late, so it's important to catch it early enough so you can do routine blood work and bone health checks to figure out if your bone density is low. Sign number 7, difficulty concentrating or brain fog. Ever feel like your memory is slipping or your brain isn't firing like it used to be? Low testosterone can impair cognitive function, making it harder to stay focused, remember, remember details, or process information quickly. If you find yourself rereading things or zoning out in and out of conversations, it might not just be stress, it could be your hormones. So, what do you do if you recognize these signs? First, get a blood test. And the only way to, this is the only way to know for sure. Ask your doctor for a full testosterone panel, including free and total testosterone. And second, start working on the basics. Improve your sleep, clean up your diet, reduce stress, lift weights, and get sunlight or supplement with vitamin D. This may seem small to reset your body naturally. And if levels are still low, talk to a healthcare professional who specializes in men's health. May be candidate for testosterone replacement therapy, but it should always come after trying lifestyle changes first. So here are my final thoughts. Low testosterone isn't just about aging. It's a health issue that affects your energy, confidence, relationships, and quality of life. Recognizing the signs early gives you the power to take back control. If this video helped you, hit the like button, subscribe for more, hit the like button for more men's health tips, and share it with a friend who might need to hear this. Drop a comment below. Have you experienced any of these symptoms? What helped you bounce back? Thanks for watching. And here's to feeling strong, focused, and full of life. Thank you.